Hey. Hey there. How are you? Good. Can I just get you to verify for me your name and date of birth real quick? Thank you. I know, but we have to do it every single time. It's one of the ways we make sure that your identity and all of your information stays safe, okay? So, alright. I have you here today for a pre-surgical consult for ear reconstruction. So what that means is we're going to be doing a few things. I'm going to be taking some pictures of your ears and surrounding facial structures. We're also going to be doing some x-rays, so taking some internal pictures. I will be examining the ears both inside and out, looking for anything that might cause a complication or might require me to change my technique. And then I will be also taking some measurements of your ears just to make sure we have all of the information before we go in, okay? Okay. Do you have any questions before we start? Well, if you happen to think of anything, just go ahead and feel free to ask, okay? So let me just take a look here at your medical history. I don't see any sort of contraindications, so let's go ahead and get started. So the first thing we're going to do is I'm just going to be taking some photos, okay? Just with a regular old camera here. So you don't have to do anything, okay? Just going to be moving around you and taking some pictures here, okay? Oops. And then turning the camera off because, of course. Okay. Alright. Once more with feeling. Okay. take a quick look here. Okay, I think I have just about everything I need, but I'm going to take a picture of you just straight on and just relax your face, okay? You don't need to smile or anything. Just want to get an image of the symmetry of your face. So okay, perfect. So that's everything we need for that. I will get those uploaded as soon as we are done here. So I'm just gonna grab some gloves. So, is it okay with you if I touch your ears? Thank you. It's just important that I make sure that there is no evidence of scar tissue or keloids, anything that might change the outcome or require a different technique going in, okay? So, first I'm just taking a look. Just getting an idea of the symmetry of how your ears sit on the face. We want everything that we do to be nice and even. making sure that we're thorough here. Okay. Not feeling anything that would be a contraindication or would concern me, so that's good. Okay, so then just gonna get an otoscope so we can take a look at the inside, okay? So, we left an old cover on here. Get a new one. And we will be doing a thorough cleaning before your surgical procedure. We're not going to do that today, but we will make sure going in that everything is perfectly clean. Okay. So, let me know if this causes any kind of tenderness. Should not. Okay. So just taking a look inside of your right ear. Looking for anything like a narrowing of the meatus or the ear canal. Any sort of condition or structural abnormality that might affect the surgical outcome or technique used. I'm not seeing anything in that regard here. The inside of your ear looks nice and healthy. Check the other side here as well. Positioning the otoscope in a way that lets me get the best visual here. Looking on this side now to see if there's any sort of difference or change compared to the other ear. The internal ear on this side looks good. I don't see any sort of inflammatory processes or erythematous skin. Anything that would be a concern. Okay. So I think in regards to the insides of your ears, we are good to go. At least on otoscope exam. Just take a quick note here. Now we're going to go ahead with the x-ray portion. So let me just really quickly doff my lab coat here and don some protective x-ray gear. I have this lovely, attractive, protective agent for you. So, put this around you. So. Trying to jostle you here. Just want to make sure that we protect your thyroid. And it looks like we are good. So I'm going to position your head here. Like so. Pull. It's gonna be right up against your ear like this, okay? Okay. So I'm gonna have you stay very, very, very still for me, alright? Put a hand behind you. Okay, you can relax. And So hold just like that, okay? Relax. Now, going to position your head just like so, right here, okay? Position it just like so. Change the angle slightly. Perfect. Okay. Great. Stay very still. This is the last time. Relax. Let's move this out of here, out of your way. Go ahead and remove your apron here. Now mine is too. Lots and lots of Velcro here. Okay, so we are going to start the measurements. I'm just going to start my data entry program real quick. Bluetooth keyboard here, so real quick I'm just going to be entering your name. Okay. to start, I'm going to be using just a ruler here to take some measurements of different points on your ears, alright? So this is probably going to take a little bit to get through, but it's not going to be invasive or anything, I promise. So, start on the right here, okay? Lining it up. Okay. Okay. Take the same measurements on this side as well. So we're almost symmetrical. Okay. And this side here. Lower. measurement with this guy, and then we're gonna switch. Measuring this. Okay. Right. And on the other side, get the same. Alright, cool. You to the side. I'll be back. So this measuring tape is not my favorite because it sticks, but I need to use this guy to get the curved measurements, like the curvature of your ear, as well as in terms of the facial placement of the ears, to measure the symmetry. So I'm gonna feel possibly the tape going around your ear. And on this side now. And we're sticking. There we go. Same both sides. arm behind you real quick. Clear your hair just a little bit. So now I'm going to be measuring different landmarks on the face, okay, just to have data about the placement of your ears on your face. So first I'm going to go ear to ear across the eye line. And again, to make sure we get the same measurement, starting from here to here, which we do. Okay. And now I'm going to do that. Same measurement, but different angle. Opposite direction to make sure we get the same. A little lower. Oh, stop sticking. we do our measurements twice, so that way we can avoid human error. Okay. So now do lengthwise. I know my tummy is a bit rumbly. Seems to be the pattern when I drink coffee. That peristalsis. Some of these are a little awkward, I apologize. Hair out of my face. Just making sure I haven't missed anything. It doesn't appear that I have. So good. Okay. So we got 2 more to do here, alright? You're being a great sport. I know this is kind of boring, but it's important. So that way we make sure we get exactly what you want. You want to make sure that you feel comfortable and confident going in here, and also that you'll be happy with the result. Okay. And our last one. protect your privacy. Just need to take a quick note here. Okay. Just checking here. Would you like to have your consult notes and findings forwarded to any physician? Okay. What's the name? Okay. Do you have a phone number for their office? Yeah, go ahead. Perfect. Okay. Okay. All right. Anybody else? Okay. And then I do have here that we're going to forward to your ENT as well. Okay. And I will be forwarding a copy of the films to both of these physicians via courier, so they'll be able to take a look at them themselves. So then, just going down the checklist here. We're also going to have you do a consult with your anesthesiologist. They will have their own exam and series of questions for you. It's very important that we get all of the information we need to make sure that your surgery is successful and that you stay asleep while you're under anesthesia. Yeah, definitely ideal, isn't it? It is definitely a common concern for all of our patients, which rightfully so. I'm going to get all of this information, data entered into our program, okay? And then myself, your anesthesiologist, we will be going over and reviewing the information together, okay, to make sure that we have everything and coming up with a surgical plan for you. Once we have that put together, and it generally doesn't take any more than 48 hours, you will receive a phone call from our surgery scheduler to schedule your procedure, okay? Yeah. The healing window is actually not very long, it's pretty quick. Generally, people are back to normal, no more scars or symptoms within 4 to 6 weeks. So, should not be too invasive in terms of your lifestyle. So, okay. Do you have any questions for me before I step out? Okay. Well, you can always give me a call should that change, alright? Okay. You take care, and we will be in touch very soon. Promise.